Well, it is a common skin problem affecting about 6 million people living in the U.S. In today's health segment, we are talking about something called melasma. And with me now to look at who's most affected and how to prevent it, of course, is Dr. Mitchel Goldman. Dr. G, he's here every Tuesday. Nice to see you as always.
Good to be here.
You know, I was kind of chuckling as I saw this subject matter come up because this happened to me. And it was after my second daughter was, or my second daughter, I only have 2 kids. My son is first, so he's not going to like that, but my second child, and I had this funny blotch on the side of my face, and you say that dark patch is this thing called melasma. So what is it?
But you were actually pretty lucky. Melasma develops from pigmentation, and when you have estrogens and hormones in your system, especially after pregnancy, it's even called the mask of pregnancy. Also with ultraviolet light, stage lights, sunlight, it'll actually make it come out. So you were one of the lucky ones. Melasma doesn't usually go away without treatment. And I know you sort of forgot the types of treatments, but in dermatology we have a variety of different creams that we can use to make melasma go away or less noticeable. Sunscreen, of course, the most important thing. And it has to be sunscreen every day, even if you're not in the sun.
Is there something within its character that you know right away that this is melasma as opposed to something else? Because, you know, I'm Irish, I'm freckly to begin with. When I first saw it, I thought, well, geez, what did I do?
Yeah, so it definitely isn't freckles because it's more confluent or widespread. It's usually always on the cheeks. The forehead is another common area, especially the mustache. It's almost like called mustache melasma as well. And so it's in very key locations.
And does it only happen to women?
90% of the time it's women, but it can occur in men. It occurs in men more often if they're under therapy for prostate cancer, where they have decreased testosterone, more estrogens, but it can occur in normal men as well, but fortunately to a lesser degree. Now, melasma is more common, not so much in the Scotch-Irish, but in people with a darker skin complexion. Hispanics, very common to get it. Persians, Indian races. So the slightly darker races are the ones that very commonly get it.
Boy, that's interesting. So what are the treatments that are available?
Well, as we said before, sunscreen, single most important thing every day because we have to block out even the lights in the rooms, but also topical creams. A company here in San Diego, Skin Medica, developed a botanical cream called Lytera, which works amazingly well for melasma, no irritation. Prescription creams like hydroquinone can cause irritation, and now we have a variety of different lasers that work with the creams. We have intense pulse light, we have fractionated lasers, and a new one called Clear and Brilliant. So your dermatologist has a whole armamentarium to make melasma go away.
All right, now that was a college word. I'm impressed, that last one. All right, always great to see you, Dr. G. We'll see you next Tuesday, and thank you for that. And Walter, it's not permanent, that's the good news.
Yeah, I learned something new today too as well. Thanks for that.